Wonderful. So we're now recording. Couple more practical things. Closed captions is enabled for this visit. So if you want to have subtitles along the screen, you can select that in the Zoom settings at the bottom of your screen so that you can have subtitles to support you as we're talking. And we're going to be having lots of conversations in breakout rooms this morning. So there'll be lots of time to connect with each other and to debrief what you're learning. But if at any point you prefer to stay out of a breakout room and you'd prefer to be in a space where you can just reflect on your own, have a bit of silent thinking time, you always have the option to stay in the main room. So you can always choose not to accept the breakout room invitation and stay in the main room. Last thing to mention before I introduce our speakers this morning is that you were sent a resource pack a week or so ago, and one of the things in that pack was something called the Curiosity Canvas, which is a reflective tool to help you capture your learning this morning. So if you haven't got that to hand, you might like to grab that, and then you can refer to that throughout the visit this morning. So I'm just going to take a moment to introduce who we've got talking today. We've got Eloise Smith-Foster. Eloise, do you want to say hello and give us a wave? That's Eloise.
Yeah, morning. Great to be here. Thanks,
Eloise. Eloise is the lead service designer at Futurice, and she's also a futurist working at Futurice, which is a bit of a mouthful. Eloise, really warm welcome. We've also got Suzanne Hogg, who's the service design director at Futurice. Do you want to come off on mute, Suzanne, and just say hi so people know who you are?
Hi everyone, it's lovely to meet you all. Really excited about this morning.
Fantastic, thank you, Suzanne. And then we've got another Suzanne Ayupa, who is an associate of the Co-Production Network for Wales. Suzanne, would you like to say hi?
Bore da pawb. Good morning, everybody. Really great to be here.
Wonderful. So we'll be hearing lots more from Eloise, Suzanne later on this morning. But first things first, wanted to give you a chance to connect and to meet each other this morning. So we're going to do an activity called Wild Tea, which lots of you in the Q community might be familiar with. Give me a wave if you've taken part in Wild Tea before, or give me a thumbs up. Great, Zarina knows it. Some people are looking at me blankly thinking, what on earth is this? So the way this is going to work, it's a liberating structures tool designed to help you connect with each other in a sort of, a deep and dynamic way. So the way this is going to work is I'm going to put a prompt in the chat, a sentence starter. I'm going to put you into a breakout room with one other person, and you're going to have around a minute and a half to answer that sentence starter with your partner. So to complete the sentence. So the first sentence we're going to complete is, I was interested in this visit because. So don't overthink it, just when you get into your breakout room, why were you interested in this visit? What's brought you along this morning? And then when we come back together, I'll put you into a new breakout room with someone else, and there'll be another sentence starter to complete. So you've got a minute to think about this now while I set up the breakout rooms. Some of you might be in slightly bigger groups. And I'm opening up those rooms now. So about a minute and a half to share why you were interested in this visit. Welcome back. I hope you had a lovely time connecting with some people. So your second sentence to complete is, one thing I love about my current work is. One thing I love about my current work is, and I'm opening up those breakout rooms now. Welcome back again. So we're going to do one final round before we hand over to our hosts and speakers today. So in your new breakout rooms this time, I'd love you to complete the sentence. Today, I'd really love to leave this visit with. Today, I'd really love to leave this visit with, and then complete that sentence. So your last minute and a half, opening up those breakout rooms now. Welcome back. Welcome back, everyone. I don't know if that felt hectic or fun or wild, but I hope you had a lovely time to connect with each other and to think a little bit about what you want to get from today and what's brought you along. So thank you so much. I'm going to hand over now to Eloise to give a little bit of framing for the day, and to take us through the first few things we're going to share. Eloise, over to you.
Brilliant. Thanks very much. I'll just set my screen share up. Just make sure I have the right one. Okay, is that nice and clear for everyone? Okay, brilliant. Seeing some thumbs. Perfect. So thanks so much for kicking us off, Kate. Really excited to be here and talk to you about this topic of strategic foresight and futures thinking, and getting into the sort of practical and hands-on side of that as well. So we're going to start with a short introduction to Futurice, our culture and ways of working, how that feeds into our approach to futures thinking, and then go into demystifying futures thinking somewhat, sharing some examples before doing a deep dive into the Wales Council for Voluntary Action case study. And we'll have some hands-on activities throughout, but especially after the break, we'll be trying out a couple of key tools and methods that we use in a lot of our work. So hopefully this is fresh for people, or a fresh perspective on that for people who have maybe given this a go in the past. And there'll be chance for Q&A throughout, and especially at the end when we do a wrap up. So I'm going to hand you over to Susie to give an introduction to Futurice to start off with.
Hiya, so I'll just give you a really quick overview of Futurice. It'll just take a couple of minutes. We're something of a household name in Finland, where we caught the crest of a wave as early pioneers in digital transformations, working as a cross-functional group covering things like strategy and service design and product design and technology and software engineering and data, all that kind of good stuff. So our focus is really on creating good quality digital products and services, but we also have an emphasis on helping clients build their own operational capabilities at the same time. And so we help companies become more tech, data and AI enabled on one side of the coin. And on the other side of the coin is very much around human-centered design, design thinking and design-early approach. Can you switch to the next slide, please, Eloise? So in terms of size, we're about 700 people in total, and we've got operations in the Nordics and in Germany and the UK, obviously, because that's where we are here today. And we've been around for about 23 years. So our core values are a really beautiful thing, and they're held really true. We hire by them, we live by them, and it's a really lovely way of working. We really do genuinely care, trust, and believe the best in each of us. We're working with healthcare providers to understand the needs of patients, carers, and staff, and connect digital technologies into the operational contexts and business environments. And we call it a full stack approach. So it's everything from strategy and vision to the cultural and organizational process changes to the technology capabilities and data infrastructures. Next slide, please, Eloise. Next slide, please, Eloise. And just to give you, if you go back one, please, Eloise. There we go, right, landed. If we just give you a very quick overview of 2 or 3 jobs that we've done with clients in recent years. So one of our biggest healthcare projects really is with Terveystalo, which is a huge Finnish healthcare service company that we've been partnering with for over 5 years. And we've designed all of their digital mobile services from scratch. So anything from booking an appointment to conducting a virtual doctor's appointment, or from making e-prescription processes between pharmacy patient and doctor. Each service has been based on understanding the needs of multiple stakeholders and integrating them within a broad ecosystem. And the next one, Feacon South, for example, is a cancer centre, and we were involved in improving the patient journey for adolescents and young adults being diagnosed. And it was a tiny engagement. We just created a series of workshops and co-designed potential solutions with patients and with healthcare professionals to gain insight and create pathways which enabled young people to access a wider range of care, helping them to confront fear, survive their crisis, and rebuild their lives. The next one at Tays, which is a central hospital, we were commissioned to redesign their backstage processes. So in response to the rapidly changing operational environment at the onset of the pandemic, we redesigned 10 prioritised hospital support services, which again were done by understanding needs first. And we worked collaboratively in sprints with hospital staff, where we were modelling and visualising the current state processes, and then we were co-designing the desired future state processes. And then we define the change required between those 2 states and hatch an action plan on how to get it done. And we ended up providing them with operational models, streamlining workflows, and helping them to focus on what was necessary and essential to do at the onset of COVID. And the last one here is a capability building project at Payet Jaime, which is a public provider of social and primary healthcare services. And we worked with their teams and their leadership in order to be able to help them improve their digital maturity. So one of the challenges that we see is that the adoption rate for digital services can be hampered due to a lower understanding of the digital world. And so we've designed a long-term programme of digital coaches and digital mentors to run in several healthcare districts to systematically improve the digital maturity of their organisations. It's about training and enablement and working with health professionals to help them learn how to use and leverage digital capabilities in the best way. So that's a little bit about our service design practice, and designing futures is a newer way of working. So I'll hand over to our expert futurist, Eloise, to explain.
Thanks, Susie. A lot of the sort of foundations of our culture and practices have been developed and iterated over time, learning and bringing in different disciplines. We look to sort of lean and agile practices that come from the tech space, human-centered and design thinking from the design space, and organizational theories. And sort of we are a self-organizing network organization, also known as a teal organization. And so what all these disciplines have in common is there's a big focus on iteration. So you and kind of self-leadership. So looking, trying things out, experimenting, learning and improving very proactively rather than developing something to perfection and releasing it. And the other sort of key commonalities are this interdisciplinary teamwork. They're highly co-creative. So you heard from Susie, we're very used to bringing in different disciplines and see a real richness in bringing in diverse perspectives to solve problems. And this approach makes us very adaptive to change, to learning from feedback, learning from different cultural challenges. And so all that as a foundation has informed how we approach futures thinking and how we apply that. And so we combined these methods, lean service design, with this kind of futures thinking and integrated that into a toolkit. So this is a lot of our resources are open access. We have lots of toolkits including service design if you're interested. But for this session, we're looking at our Futures toolkit, and that's what we'll be trying out some of those today. But this is kind of a step-by-step guide to our approach with a handbook to really dig into complex topics and apply futures to them. And in the next section, I'll be going into a bit of the theory and key steps in this process that we usually go through. So that leads me on to futures thinking. But before we dig into the background, I wanted to kind of share what we heard about your perspective on the future of health and care. So in your registration, we asked you, imagining an ideal future where anything is possible, what is the one thing you'd love to see change about the UK health and care sector by 2035? So starting to look a bit longer term than most organisations do, which is what futures thinking is all about. And we can see here a beautiful Wordle Kate put together for us, showing the key topics coming out. So we can see a real interest in, of course, health and care, but then collaboration, community, a more systemic approach, patients, data, prevention. So you can see a sort of high level view of the themes there. And then digging into that, really inspiring to see the specific quotes. And we sort of surface these as kind of a good summary of some of the key themes coming out of what you'd love to see in the future of healthcare. So, for example, fundamental belief in the goodness of staff. So kind of trusted and empowered employees who can have that self-leadership. Not only connected healthcare, but healthcare being connected in an ethical way, with people having agency and ownership of their data, a much more seamless and patient-centered care, unique to patients' profiles, and a more integrated and holistic and long-term approach to health and care backed by evidence. So I hope you recognize some of your thoughts in there, and that can provide a background as we start digging into tools and experimenting with those. And to start with, we wanted to open this up more and have a bit of discussion. So we'd like to create breakout rooms and just reflecting on those quotes and that visual, discuss together what resonated or surprised you from that description, and what's one thing you'd like to see in the future of health and care. And you can maybe elaborate and expand on what you wrote in the registration. So I think Kate's going to set up the rooms.
Yeah, I was just going to say, Tina, you read my mind. Could you just swing back to, the word cloud, and then, so maybe you might want to take a quick, if you've got your phone handy, you might want to take a quick photo so you can look at this in your breakout rooms, or just remind yourself what you're looking at. And should we go to the next slide so people can see the quotes? And just as we do that, quick reminder that if for any reason you don't want to go into a breakout room right now, you can stay in the main room, and you're more than welcome just to have some silent, quiet time to reflect if you'd prefer. So those questions are in the chat, and I will open up those breakout rooms now. And we've got, how long have we got for this? 10 minutes? Have I read that right, Eloise? Yeah, 10 minutes. Okay. Opening up. Yeah. Oh. Welcome back. Welcome back, everyone. Hope you had some lovely discussions in your breakout rooms. And I wanted to give you a minute now just to write in the chat one thing that you're taking away from that brief conversation you just had then. It might be the spark of an idea or something that resonated or something that's got your thinking going. So just a moment to add something into the chat. What are you taking away from that mini breakout room discussion you just had? Welcoming along those of you that just joined while people were in breakout rooms. People have been discussing and sharing what resonated for them from when thinking about the vision for the future of healthcare. Really interesting comments. Thank you, Kerry. Thank you, Nikki. Thank you, Petrenka. Yeah, lovely. Thank you. And would love to invite just a couple of people to elaborate out loud, so to come off mute and to share. I'm particularly interested in, were there themes and connections between what you were sharing in your breakout rooms? Would anyone like to come off mute and share a little bit of the flavour of the discussion you had in your breakout room? Feel free just to give me a wave or to put your hand up if you're happy to come in and share. Nikki, go for it. Thank you.
We were just sort of thinking about that sort of agency thing and the control aspects of organizations. So even though it is all the systems change, these things are about people, the systems are absolutely in our way as well. And we were just really reflecting on that autonomy that had been allowed during COVID, and the iteration sort of type of thing, which is, you know, we're, those of us who do quality improvement, is kind of music to our ears. But actually how easy it is for organizations to close it down, and how difficult it is to keep those channels open and allow that freedom to explore and learn to do it in a safe way as well, which you can with improvement methods do that quite safely. But organizations seem pretty reticent to give free rein and to allow the digital support that is required. So some organizations don't even allow their staff to use Zoom, you know? So, and that's all about, for me, that's all about control. It's
that's such a dance, isn't it? That tension you're describing. Thank you very much, Nikki. Anyone else want to come in with anything they want to share back from the conversations they had? We've probably got time for one more person. What was the flavour of the discussions in your room? Okay, well, maybe we'll pause there on feeding back. And Eloise, shall I hand over to you to take us through the next part of the morning?
Yeah, that's great. Thank you. Just so fascinating to see the rich comments in the chat. Lots of food for thought there. Yes, so hopefully that's sharing fine again.
Yeah, perfect.
Great. So we're going to start with a bit of kind of demystifying futures for those who are maybe newer to this before going into some cases. So why is futures thinking relevant? It can be quite challenging to communicate internally why it's important. We know that we're living in an increasingly VUCA world, which stands for volatile, uncertain, complex, and ambiguous. And many have said that one of the key challenges of our time, particularly for not all societies and cultures, but for many in the global North and Westernized societies, short-term thinking is a really big problem. A problem in political cycles, in organizational cycles. And in sort of conventionally in the futures space, organizations have looked at trends and analyzed which future is most likely to happen, which future is most probable, and aimed to react or maybe prepare for that future. But futures thinking is all about taking a more systemic approach to analysing ideas about the future, data about the future, and being more proactive in reacting to opportunities and threats in that future. And core to this kind of discipline is understanding that there are many possible futures, and you can imagine the future like a torch beam. Where you're standing now holding the torch is the present, and the beam it's very clear. And as you go further away, further into the long-term future, the beam widens and the spectrum of possible futures becomes broader and less clear. And we often talk about there being possible futures, kind of ones that are less likely, very dystopian, very utopian. And that's what gets a lot of attention in the press. But within that, there are a range of more plausible or probable futures. And often what we focus on in the work I do is, of those plausible futures, which is the most preferable, and how can we actually make that more likely and have agency over the future? And we aim to do that in a participatory way, which is sometimes called participatory futures. So, for example, we might say in the health and care sector, connected healthcare is looking quite probable, but maybe ethical and patient-centered connected healthcare is possible, is plausible, but it's not necessarily guaranteed. So how can we make that more ethical future more likely? And also not only focusing on the short term, but 10 to 50 years in the future beyond. And some futures thinkers think in an intergenerational way, thinking about intergenerational justice and how can we bring that perspective in. And so our approach to this, which is captured in the toolkit, is kind of a 4-step process. So scoping and horizon scanning, that's all about framing the space we want to focus on. That could be an industry, and really researching that. So if it's health and care, what are the key trends? What are the weak signals that aren't yet trends that are indicating something further in the future, a kind of pocket of the future that exists today, and really mapping and gaining an understanding of that industry and our sort of focal area, from sort of the human to the organizational to the political, economic, environmental, getting a big picture view and then zooming in to various scenarios and starting to build a picture of what could the world look like, the future look like in this space, within a certain boundary time in 10 years, 20 years. And how can we explore and experiment with that future and its implications for our organization today, so we can better prepare or better orient to that future. So that often involves visualizations or prototypes, which stands for provocative prototypes. So making artifacts from the future that maybe don't exist yet, but by making them tangible now, you can get feedback, you could get patient feedback on technology or a service, which maybe isn't possible now, but could be possible in the future. So you're already getting insight on the possibilities today and getting feedback and able to think about that. And then we need to go into action. So this is where evaluation and road mapping comes in, turning your selected visions or sort of direction into a map, evaluating it, turning it into a strategy, into an action plan that can be operationalized and actually has an impact on what you're doing today. So just bringing in some light case studies before we go into looking at how we did that with WCVA. We've done futures work with East West Rail, where they were looking at opportunities to improve the UK railway and better serve their customers. And they wanted to know, what digital services will a traveller use throughout 2030 and beyond. And we undertook that horizon scanning, workshops to create scenarios based on emerging trends and plausible futures, and supported them to think about the future in a much more proactive way rather than reactive, and ultimately created a set of recommendations and supported them to kind of future-proof their digital strategy, make it more resilient, and help their development of new journeys. And this is one of the artifacts we made, is user journeys, customer journeys from the future based on those future scenarios and what different sets of customers, what their emerging or different needs or same needs might be in that future context. So really making those scenarios very tangible down to specific kind of potential touch points, and getting more expansive thinking about what does that mean for the business and where they need to go. And this is another example. We worked with a pharmaceutical company in Europe, helping them explore potential self-care models for MS patients and looking at technologies that don't exist yet. And so we created a prototype, so mocking up the experience of a technology that doesn't yet exist, but experimenting with that in a workshop with the patients to understand how could they use this, what opportunities do they see to improve their care, what could the interactions be like, what could the service experience be like around that technology that supports them. And how could that support them better than the services or technology of today? This is sharing a few other examples, not by Futurice, but within the industry that I take inspiration from. And just to show, this work doesn't always need to be sort of polished. This is a really wonderful project by Pupil Bisht, where she developed a Foresight tool inspired by local storytelling within a community in India, and co-created future scenarios in a way that worked for that community and specific age groups, to support dialogue and a sense of agency over the future. There's wonderful work going on in Japan around future design, which is also very inspiring. So citizens in towns will decide policy together with a set of citizens representing the needs of people in the town today, and a set of citizens representing, imagining their future citizens from 2060 and representing their needs and views. And they wear a set of ceremonial robes to kind of help them get in the experiential mind space and imagine a kind of in a different time. And this has been really successful, and a lot of studies have shown that much more transformational policies were developed by the people who imagined that they were in 2060. Much more transformational policies around water, around health and care and sustainability in particular. And it's actually been taken up by Japan's Ministry of Finance as a way for tackling short-termism, because it's been so successful. And again, it shows how valuable, as all these methods I'm focusing on are participatory, so centering the kind of civic voice or the voice of those most impacted by the challenge or the future that we're focusing on. Another great example, which also sets us up for the deep dive case study, is in Wales. They have the Future Generations Act enshrined in law in 2015. And connected to that, founded the Future Generations Commissioner. And they have a focus on working towards this set of values, and also created this vision for the future of Wales. And I really recommend their website. It's fantastic. You can explore this vision, the details. They have a lot of resources and toolkits on the Future Generation Commissioner's site. And so this is kind of a North Star vision to orient towards and guide the public sector in particular, but it's kind of expanded out. So other organisations are also orienting towards this more just sort of prosperous vision for Wales. And so to sum up, there are many approaches to futures thinking, but we advocate for a participatory approach because it has lots of benefits for individuals, such as a deepened understanding of key issues and emergent issues beyond the urgency of today. And it can create a greater sense of responsibility and agency in shaping the future. For communities, it can be a social process that unlocks citizen intelligence and helps social cohesion, trust building, building hope, and mobilising people to collectively respond to challenges. And for organisations, it can support identification of new opportunities, not only the narrow opportunities that those in the top level might decide are kind of important. So it can help, therefore, with better decision-making, strategy development, and alignment with the company's purpose, which is also very motivating for employees and takes the organisation in a direction that they want. And the last slide of this section is just a bit of a warning of what can happen if you don't work in a participatory way. So this is a futures vision from the 60s for, you know, kind of our time. And you can see, as is often the case when you have a very limited set of people from the most privileged, dominant group imagine the future. They imagine a future that benefits them, and they have a lot of blind spots, and they have a very narrow view. So we can see you know, an over focus on technology, but no imagination around social change or sort of economic change or different patterns. We actually see the same social blueprint of kind of 60s America implicated in the future. So that's why it's key to bring in diverse and representative voices of those who you work with, so as not to end up with dominant groups dictating the futures and where we go. And on that note, I'll bring us to the Wales Council for Voluntary Action, which is a brilliant participatory case study. And this was a very unique, innovative project where Futurice and myself co-led alongside the Wales Council for Voluntary Action, a sort of futures visioning initiative for the voluntary sector across Wales, which culminated in a refreshed strategy, a sort of 10-year vision and 5-year strategy for the Wales Council, WCVA. And there's also an open access report, so you can dig into that yourself. And this project became an internationally recognised benchmark for futures work. It's won multiple awards and had a lot of effects on the organisation and communities it's connected to, which Suzanne will talk us through shortly. So to provide a bit more background, WCVA came to us because they had a brief that they wanted to imagine better futures. This was kind of 2021, thinking of some of the points that have been brought up. The voluntary sector had really proven itself as valuable during the pandemic. There'd been a lot of freedom and unlocking of resources, and a real recognition of the strength of the sector and they wanted to bring their voice into imagining a better future for all, and be much more proactive about working towards that better future as we emerged from the pandemic. And we worked with a huge cross-section of organisations from across Wales to be as representative as we could be within the timeline. This was, I think, a 4-month project, but building on previous work engaging communities and continued after Futurice stepped away. So it's really been kind of multi-years of work, but I'm just focusing on one snapshot. So we can see we had sort of national level organisations like Scouts Cymru, and then more kind of grassroots organisations, community level organisations, organisations focused on health and care, creativity, youth, which we engaged in many different methods, from surveys and interviews to, most critically, participatory workshops and sessions over the months on this project. And really went through this approach of scoping and horizon scanning key trends for Wales and the voluntary sector, building a scenario, a kind of future vision, and getting feedback, iterating that with the input from communities, and evaluating that and supporting creation of a roadmap of next steps and actionable goals, and a refreshed 5-year strategy for WCVA and TSSW, the third sector support Wales, which is connected to all the local county councils. And this is a snapshot of the vision. We overlaid it, the sort of unique perspective of the voluntary sector, onto the future generation for Wales vision. And each of these is described in the report, but there was descriptions of the role of communities in the voluntary sector in different aspects of society in the future. And ultimately, it was a much more sort of community-oriented, just, green and regenerative vision for society. And it became the kind of North Star, a multifaceted North Star, to support organisations across the sector and beyond to work together and help co-create that future today. And on that note, it got turned into a set of actions, again co-created with representatives from across the sector, of based on ideas for how they would like to manifest that future and work together and make it possible and kind of overcome challenges. And that in turn got connected to WCVA's role and mission and translated into a set of ideas for goals for them, for how do they support the wider sector to reach this vision, and embed that into their 5-year strategy. And with that, I'll pass you on to Suzanne to dig into the kind of value and impact of this work from someone who's been on the inside and worked very closely with me during the project and also after Futurice stepped away.
Thank you, Eloise. Could everybody hear me? Yeah? Hope so. Good. Yeah, so first of all, I'm just going to talk a little bit, just tiny bit about my background. I've loved meeting you in the breakout rooms. So I'm an English literature graduate, so I'm a writer, but I'm also a conservationist. But I've worked in the third sector for over 25 years. And I've done all sorts of things, health and social care. I've done conservation work. I've done bid writing. And after the pandemic, when WCVA advertised for a strategist, a planning officer for their new business plan and strategy, I applied for it because I felt that I knew the Welsh sector good enough to be of service? And I'm just going to talk to you a little bit about the human value of this process. So the value and impact for individuals, we had a long list. Eloise has shown a slide of over, there was over 80 organizations that we worked with. We did individual interviews. But what I noticed when I first started looking at who we were inviting to workshops, there wasn't enough ethnic communities being represented. So we actually reached out to Race Council Cymru and made a special arrangement with them where we actually encouraged participants by paying a training bursary or a bursary to attend some specialist workshops to hear their views and get them to tell us what was really important to them in their communities after the pandemic. We engaged with people all over Wales from these communities digitally, and it was very successful. It was that kind of asking who's not in the room that was really crucial at the onset. And the individuals that came along, some were from African communities, some were from Chinese communities, from South Asian communities, all listening to each other and telling us what was important. We started a dialogue, and we started to make some unlikely alliances that helped build our strategy and carried all the way through this 6-month project. And it was very valued by them, and their quotes and testimonials are seeded all the way through the report. So you actually hear people's voices when you actually look at the future, the preferred future that we came up with together. So that was the impact for individuals. They felt valued. They carried through and saw the project through to the end. Organizational. We had lots of different organizations in a space away from the daily grind of work. It was a place to reflect, to really hear each other. They were able to get up to speed with research that was coming hot off the press after the pandemic, work streams. It was important to think about, that the resources that were being spent, to look at collaboration in unlikely ways, to meet where people that had the most need, how can we work together to really meet those needs, to avoid duplication in the future. And it was also an open space, there was no hierarchies. So one really good example of that is our CEO, Ruth. She spent a breakout room with very young volunteers from different organizations. And it was a really transformational conversation for her. So yes, that actually meeting people in a space away from work where you can reflect and there's no hierarchies, really valued. And then touching on a point that was made by Eloise just earlier, the sector, the third sector, we're in a COVID review at the moment. A lot of sectors have gotten flack with how they handled the pandemic, but I think the integrity and the reliability of the third sector has really been proven. In Wales, we do have this special law about the well-being of future generations, but we also have the special structure for the voluntary sector, which is TSSW. Each county has a hub, and we were able to filter funding very quickly through the structure, and we were able to mobilize our volunteers. In Powys, where I live, there's transport poverty. How we were going to get people vaccinated, we actually mobilized volunteers, and that's how it was done. Getting everybody, driving them to vaccination clinics, making sure people were supported and knew where to go and had ways to get there. So we were seen as essential work for inclusion, for humanitarian aid and well-being. And that that part, us being a valued member, was part of our preferred future we were going to bring forward from the awfulness of the pandemic. You know, we were a hero and we were going to bring that forward. And then just last, this golden thread, which we came to at the end, our vision of a more equitable and sustainable Wales. It was a diverse Wales. Everybody around the table, their lived experience was valued and important. It was going to be a green Wales, a greener Wales, where we actually thought about sustainability of all our actions. And we were going to be an equal partner for working for well-being in Wales, and we were going to demand our value. So that was the golden thread that we wove through, that we came up with, and that we wove through all our work in the next 2 years. We go to the next slide. I'll just speak a couple seconds on that. So this is a lovely slide where you can see where we took our golden thread. We had to come up with a new 5-year strategy, lots of work with all our staff, lots of stakeholders, our board. From that, in a parallel work stream, we came up with a new TSSW 5-year strategy. Big focus on co-production, big focus on community assets, and funding. From there, Welsh Government agreed to go from a year-on-year funding stream for TSSW to a 3-year funding agreement, giving us a lot more security, and it was increased. And then from our new strategies, we are able to drill down and hold workshop spaces across our peer networks and TSSW all across Wales. There's 4, one for volunteering, one for good governance, one for sustainable funding, and one for learning and development. And we were able to co-design together with all our peers the 3-year delivery plans for each of those networks. It was some going to do this in 2 years, but because everybody felt valued within the process, and also because people were collaborating in different ways, we were able to get designs, strategies, and business plans that everybody felt really aspirational about delivering. So taking the strategy and making it become real action. And then we designed a new impact framework with a different consultant called Data Orchard. That was important to do at the end of this because we were in quite a different position at the end of our futures thinking. One where we valued our sector, we actually stood up for ourselves a lot more, and we talked about our value a lot more, and we were more diverse, so we had more problem-solving abilities. And I just want to end by saying these 3 points that you can see on the screen that are sort of the building blocks I would suggest that you think about in your work to build into this process. Points for reflection, where everybody can get together along the delivery line and reflect on what's going on. It's iterative. You're going to tweak and adapt. You're going to keep it interactive, model the behavior that you want to see in the future. Not everybody's going to have the same interpretation. You know, we're not building a cult when we think about our futures. Everybody's going to come with a different interpretation to the table of what the future will be like within your service. But if you don't keep it interactive, the culture could be forgotten. So keep it interactive. And then also people along this journey, unfortunately in WCDA, we lost our European funding. So after this process was finished, we had to restructure. And a lot of people with this knowledge of the continuity of the project were lost. I would say to you, within your organizations, as you start this work, even if you have progressing to different roles or secondments, keep the knowledge, if you can, within your project. So while you're working in the next 5 years, the continuity of the work that you've done and why is there. And I'll just stop there.
Brilliant. Thank you, Suzanne. We want to do a breakout, but before we do, it's time for a break. So just so you're aware, we'll go on pause for 15 minutes and come back at past. And then we will organise into breakouts. There'll be room for reflection, discussion, and also asking myself and Suzanne questions. So I'll just pause on that as sort of to give it spaciousness to percolate over the break.
Thank you, Eloise. I wonder, looking at, so we're a little bit behind. I wonder if we should take 10 and come back at 11:25. To give people a chance to grab a hot drink, step away from your computers, but then also means we can definitely finish on time. Does that feel all right for people? Give me a thumbs up if that sounds okay. Wonderful, thank you. So we'll see you at 11:25. So Eloise, do you want me to introduce these breakouts? Or are you happy to?
Yeah, but feel free to go ahead.
Great. Thank you. So we wanted to give you some time, I guess, to sort of allow everything you've been listening to this morning to sink in and to think a little bit about your own organisational context. So we've got a few questions to share with you that you can see on the screen. So how far ahead is your organisational strategy looking at the moment? What's one thing that you've heard that sounds relevant to your context? And what questions are emerging? So we're going to give you a couple of minutes on your own first, just to do some thinking and to kind of make some notes around those questions, and then we'll move you into breakout room discussions. So a couple of minutes on your own, and then we'll move into breakout room discussions. So 1 more minute before we open up those breakout rooms. 1 more minute to think on your own. All right, so if you want to finish up the notes you're capturing or the thoughts you're having, and we will move into breakout rooms, and you'll have about 8 minutes to discuss with each other your responses to those questions. As before, if you'd prefer to stay in the main room and continue to think on your own, feel free to do that. And I'm opening up those breakout rooms now. And I'm just checking in. Colin, Anita, Zarina, are you all happy to stay in the main room? I'm just checking none of you are having tech issues. Just give me a thumbs up to let me know. Yeah, wicked. Thank you. Hi, Colin. How you doing? Oh, that was you letting me know. All good. Fine. Thank you. Eloise, I've put 6 minutes on the clock, and I think because we told them they'd have 8, I'm just wondering if there's anywhere else we can grab the time back. I'm just having a little look. Well, actually, I think that's fine.
Yeah, I
Once we
guess.
come back together.
Yeah, I guess we could have. We'd still have 5 minutes when we're back together. I was just thinking, there might be more questions and discussion.
Yeah.
So I was wondering whether to give it 10 minutes.
Why don't we get them back, ask for any kind of questions or reflections from the breakout rooms, and then move into seeds of change?
Yeah. Okay. We can see how long it takes.
Does that feel all right?
Yeah, I think that's fine. We could also take a little bit of time off later on if need be.
Yeah. Okay.
Yeah, I just want to make sure people have time to pick me and Suzanne's brains if they'd like to.
Yeah, definitely. Thank you. Hi, welcoming you all back from your breakout rooms. And I hope you enjoyed those discussions with each other. So yeah, I would love to hear any reflections from those breakout room discussions. What came up in your conversations? What are some of the things that you were thinking about with each other? We're also going to have a bit of space for questions if you want to ask Eloise, Suzanne, and Suzanne anything. But yeah, curious to hear, what were those conversations like? What did you talk about? Who would like to kick us off?
I'm happy to say something. I guess we talked about how for my organisation we've just done a new 5-year plan, and that felt for the organisation a really big commitment to the long-term future. But actually, hearing all the work at Futurice is really not long enough, and I wonder where the thinking is in terms of the 10 or 15-year plan, and if that is happening at all. So it's quite interesting to see that disconnect. And our other reflection was just about the degree of engagement. And I think it is really hard for large NHS organisations to really engage people, and particularly to engage clinical staff as well, who sort of say they want to have a view, but they don't always sort of jump on when that opportunity is offered. So actually seeing that difference in terms of engagement was really helpful too.
Lovely, thank you, Charlotte. Yeah, it's so interesting, isn't it? Feeling like, yeah, 5 years, that could feel like really far away, but then actually in the context of some of the conversations we've been having this morning, I guess the concept of the future can be different in different contexts. Thanks, Charlotte. Anybody else want to come in with any reflections or anything else that was interesting from your breakout room discussions? Andrew, go for it.
I think one of the things that we reflected on was, I guess, and just thinking about the presentation about the work that was done in Wales, was how do you get kind of everyone around when you've all got slightly different strategies? So one of our conversations was, depending on who you are, you might have a 2-year, 3-year, or 5-year look or a plan about things, and then your organization might shift or merge or align or be in a group with something else, and that changes again. And I guess, how do you try and consider being reactive to things that need to happen and need to change, but not be buffeted by kind of events in the midst of all of that? And I guess just from a personal point of view, I guess what I thought was quite helpful was actually that future cone, and actually being able to imagine the future in different ways to try and look at things. That is something that I'll be taking back as a way to try and I guess get out of the muck a little bit in the dirt, but actually then be able to kind of look forward, but keep a bit of a focus on something.
Yeah, thank you, Andrew. Really helpful. And we're gonna move on in a moment to the team sharing a couple of key kind of tools and methodologies that you'll be able to try out and use in your own context. But before we do that, are there any burning questions that you're holding that you'd like to ask Eloise, Suzanne, either out loud or in the chat? Anyone holding any burning questions at this point about what you've been hearing so far? Marianne, yes, you will be able to get the recording. We'll share that afterwards, like we do for all the visits. Eloise, I think the group is stunned into silence. So I reckon let's move on and move into the first of the tools that you're going to change.
Great. Yes, thank you. I will just get my presentation up and sharing again. Okay. But yeah, really good to hear those comments and what's coming out of the chat. And just to briefly speak to what Andrew and Charlotte brought up, I think what was really valuable with long-term visioning, even if you have a 5-year strategy at the end of it, that strategy will likely be much more ambitious from longer term thinking and visioning at the beginning, which is often the case. Yeah, really good to hear you mention, Andrew. I think that's something that we saw in the work as well. Challenges do come up along that path. It's not an easy sort of road necessarily. So there are lots of tools and methods around analysing potential threats and opportunities and helping you sort of engage with that early on and be preemptive and prepare. So yeah, really good to hear these comments getting into the sort of futures thinking mindset. And what we're going to dig into now is seeds of change. So this was one of the most central and valuable tools that we used with WCVA. If anyone hasn't come across this before, the idea here is to orient people towards that visioning of a preferred future rather than dystopias and utopias, by looking for pockets of the preferred future or radical preferred futures and long-term things today. So we might look at initiatives, innovations, organizations. It can be any sort of part of society. It could be, for example, bike sharing schemes. It could be looking at 15-minute cities or cities where they're enhancing public transport, but kind of where you can see inspiration or pockets of the future that you'd like to see more widespread, and turning for that as a source of inspiration. And those are often sort of pockets or kind of signals of possible futures and evidence of those today. So we undertook horizon scanning, which is the secondary research, looking at, it's called a kind of pestle analysis. So looking at politics, economics, society, technology, legislation, and the environment. So when we looked at Wales, we could see that the Wellbeing Economy Alliance there is very, very strong, building a movement of like-minded countries. There's a big push to focus on a well-being economy, and we've seen in the news petitions to shift to a more well-being oriented economy and critiques of GDP as a measure of success. So that's something that became a sort of theme that got integrated into our seeds of change and our vision, this orientation to a well-being economy. So we started there and we're looking at lots of resources for signals and clustering those. But what was most important and central was the voices of the people we engaged and what they actually want. So there's a wonderful quote we have permission to share from the report from Debanjali, that our young people, asylum seekers and refugees are the future of Wales. We must create an environment where individuals can nurture their talents, fuel their passion and blossom into the fullest form of themselves to contribute towards society. So it's by combining the preferred future that people are seeking with secondary research of what's actually happening that we developed Seeds of Change. And we had a number of co-creation sessions. So we kind of summed these up of snapshots of the future as if it exists today. For example, that Wales has a well-being economy and is part of a network of global nations focused on that. And we created these seeds and sort of prioritized and ranked them with input from the voluntary sector representatives. We iterated them, we got critique, we got feedback, we added to them and ended up with 55, sort of showing different facets of the future. And that, again, they're in the report and they're all sourced, so you can see where they came from and kind of what inspired them. So there was some on healthcare, for example, having community-based care, preventative health and social care delivered locally through self-managed teams, including trained volunteers from the community. So I hope that gives some insight into sort of what seeds can look like. And what we'd like to get you to do is exactly what we did with WCVA. Start to think about your own seeds that are relevant for your context. just imagine its potential effects on your community or your organization. If that seed flourished and grew, what would your context look like in 15 years? And we put that as a benchmark. But if you want to challenge yourself to think beyond 15 years, please do. And then we'd ask you to share and discuss your ideas. So we've got a definition of what seeds of change are here for reference, and some examples on the bottom, and a few connected to healthcare. So we've seen there's initiatives like Self Space in London and friendship benches starting to pop up, which are kind of integrating on-call mental health care into the high street, into communities. In the case of Self Space, that's by professionals. In the case of the friendship bench, it's sort of trained and trusted community members. And I'll pass over to Suzanne to sum up virtual wards as an example of a sort of signal or seed of change.
Oh, Suzanne, you're on mute.
Yeah.
Thank you.
I know that virtual wards are all familiar, that's familiar to all of you, and that it's not something that's not widely used. But in 2016, when I was working as a social prescriber, it was quite new. And my experience of it, working in a very rural community in Wales, is each patient, whether they were cared for at a community hospital, because we don't have any big hospitals where I live, or at the GP surgery, the care team, including occupational health, ward sister, consultant, pharmacist, social prescriber, physiotherapist, all met once a week to discuss the patient's needs, to look at review of medication, so the consultant could come up to speed with notes and input from everybody. And we all learned from each other from being in that same room. Now I know that this practice has spread a lot since 2016, and it's used for lots of probably different applications, but that was a seed, that change practice that perhaps I'm hoping didn't cost a huge amount more money. It was just putting people in the same place at the same time and sharing their input around the patient, and led to more patient-centered care. So that's just an example of a seed.
Yeah, thank you. And it's a really good example of how, in this VUCA world, virtual wards became so prescient when the pandemic hit, in a way. And it's a sort of pocket of the future in 2016 that now is much more, has grown and flourished. So it's a great example of how they're easy to spot in hindsight as well. So I'll pause there, and we can prep for the breakout rooms. And the focus is asking you to think of a positive seed of change related to your context, to health and care, to your organization, and thinking about the impacts of that on your organization if that grew and flourished.
Yeah, great. Thanks, Eloise. So that prompt is in the chat, and we're going to have 10 minutes for this, just under 10 minutes, and I'm going to pop you into breakout rooms now. Hi, everyone. Welcome back. Sorry if you were cut off mid-sentence. I was often the way. I hope there were some fruitful conversations. We're going to move straight into sharing another tool with you. So Eloise, shall I hand back to you?
Thanks. That's great. Yeah, this builds directly on what we've been doing. Yeah, thank you. I was just in a breakout room, didn't get to say hello, but great to just listen in and hear some of the seeds of change coming up. And it sounded like there were really really rich discussion and thorough thinking about how that could develop over time. And just a quick note on the seeds of change as well before we jump into the next one. I saw a really good comment in the chat about how do we make sure the future focuses on the collective good from Kerry rather than individual bias coming in. And I think something we haven't mentioned is, but hopefully has kind of come through me and Suzanne's discussion, is the importance of the facilitators of this process to kind of guide and orient people. And by focusing on seeds of change and secondary research that's about possible positive futures and long-term futures, that orients people to sort of lift up from current day-to-day agendas and biases and sort of orient to those futures that are a bit more focused on the collective good. And again, by making sure that engagement is very representative and not only a small group or kind of the currently dominant group. That's key, as that can end up sort of reinforcing current problematic paradigms if we have only current power holders sort of dictating or having too much hold on the future vision. So it's up to the facilitators to, as Suzanne described, build trust, build networks. If they don't exist, find critical friends, and make sure it's a really representative process. So I think in the case of health and care, bringing in the patient voice would be a good way of keeping that balance and making sure it's a representative patient voice. So that leads me on to 3 horizons. And what you've been doing is, this is a nice kind of summary of the futures process again. So we've moved away from that most probable future into a spectrum of plausible futures, identified the most preferred, and now it's about turning it into actionable strategy. So this can mean moving into co-creating opportunities or strategic developments around your organization, your culture. In WCVA, the vision prompted us to actually question what is the role of WCVA in the future. They've been this influencer, educator, funder, but what would their role be in this future? How do they need to change as an organization? And we can start to look at process and maybe customer experience improvements, new technologies or people practices that could be relevant to embed into the strategy based on that ideal future. And one way we get to this kind of action plan or roadmap is using the 3 horizons. So this is a brilliant tool. It's really flexible. And what you have is you create a map with this. On the right, you put your preferred future vision. So you might have that visual, that word cloud, those quotes we saw after they've sort of evolved and developed into a holistic, cohesive picture. That's your horizon 3, and the line goes up because we've got seeds of change for that in the present, but we want it to grow and flourish and become, more mainstream. And horizon 1 or H1 is where we are now, business as usual. GDP is the measure of growth and health of a country, and that's what we want to sort of fade out, anything that's not working. And then you have horizon 2, and that's kind of the bridge. So in a workshop setting, how we approach this is You know, we've got our vision, we go to Horizon 2 and say, well, where are we now? Where are we now? What seeds have we got? What does the current situation look like? Then we go into Horizon 2. Okay, how do we build that bridge? What's blocking us from reaching that future? What are the challenges? What do we need to know? What can we find out? How can we work together differently to overcome those challenges? And we had such rich conversations in the sector. You know, we had representatives from all different types of organizations, also the private sector, public sector, the Future Generations Commissioner, all discussing how we build this bridge. And again, answers to one of these points, that there's a lot of repeated sort of actions and ideas. So it helps people think about how can we actually come together and be a more powerful force in collaboration and work with different sectors in new ways. And so I've sort of overlaid some questions on Horizon 2. We don't have time to sort of go through the whole process, but I want to focus on this because you've started to create that snapshot of your preferred future by fleshing out those seeds. So now I'd like you to go to that middle step and think about what change or conditions are needed in your organization to enable those seeds to grow and flourish. So could it be, for example, different management structure, or a closer relationship with patients, or what could be needed? And what are the easy wins, or what are the things you could start influencing today that kind of take you on very small steps towards that future? And what is one thing you could even do this week? So it could be, you know, simply a conversation with someone, bringing up a new idea, or sharing an inspiring article with someone. Or maybe there's something else you can think of. So just really getting into that mindset of, you know, how does your organization need to shift? What does it look like in this preferred future? What are the conditions needed to get there? And what could you do? What can you influence to start getting on that path? So it's really thinking about, in your position, you know, what power do you have to start contributing to change? So we are going to jump into breakouts again, a final breakout discussion, and hopefully you can build on the discussion you had in the last session on seeds of change, or think back to that word cloud vision as a reference.
Great. So I'm going to open up those rooms now, and looking at time, I reckon we've got just under 10 minutes, Eloise. Does that feel right for you?
That's fine, thank you.
Great. Opening up those rooms now.
Because, you know, they're just, oh right, people are coming back, but you know, because they're not allowing the things that make it possible to do things. So I think that gap might widen in terms of what people in health, in national, you know, in nationally provided services can do versus what people do in their normal lives.
Thank you, Nikki. I'm just welcoming everyone back. We've just been having a little chat in the background. And Eloise, I'm going to hand over to you to do any kind of sum up that you want to share, and then perhaps we can move into some space for questions. And then Nikki, if there's anything else you want to ask, we can pick that up. Eloise, what would you like to say in summary as we move towards the close of today?
We just had a few final slides, and then we'll open the space. But I hope, everyone had really rich discussions. We were having a good little Q&A here. So some final reflections and kind of to sum up the key benefits of futures thinking, if you need to communicate this in your organization, in our experience, it's led to more participatory, creative and resilient organizational cultures by helping kind of create that safe space, get people out of the grind of their daily urgent tasks and thinking more collectively about the long-term future and wider consequences of what they're doing, a more representative strategy. And maybe this speaks a little bit to what you were saying, Nikki. One thing that we found is by slowing down the process and making sure we engage people and engage a diverse and representative cross-section, it does take time to build trust, build the networks and support engagement. And it's kind of a slower pace than strategy often runs without participation. But we found by the end of the 6 months, things actually move quicker and more effectively. So the strategy that was generated for TSSW was signed off by the county councils across Wales much more readily and quickly and with less friction than it has done in the past, because they saw themselves represented and they felt really on board with the vision and strategy and could see their voice and their needs considered in there. And ultimately, with this approach, looking at sort of preferred futures, doing that research to consider, politics, the environment, and prompting that, we result in more just and green and inclusive futures. And just to let you know, if anyone's interested and would like support to get started with this approach, we can help you with we have a 1 or 2 day workshop that we can facilitate to help reframe thinking and start to think about how to tackle a specific challenge. Dive into an area for a couple of weeks to do some horizon scanning or start to kickstart the process, or what we did with WCVA, 1 to 6 months, a really strategic exploration, building capability and embedding futures thinking so your organization can take this kind of thing forward. And I've mentioned to a few people, but this futures process and each step of the project is documented in this open access voluntary sector futures report, as well as the details of the vision. And you can access that here. We've got the link. You can also access WCVA's community-oriented futures toolkit and our Futurice one online as well. So that's great to just jump into, try out some of the tools in there and kind of get going if you're excited by what you've heard in the session. And I'll pause there and again open up to questions. Anyone has reflections from the breakout room or questions they'd like to share.
Thanks. Yeah, we've probably got 3 minutes or so before there's a couple of things I want to share before we finish at 12:30, but we've got 3 minutes or so for you to ask Eloise, Suzanne questions. And perhaps if you're happy to stop screen sharing, Eloise, then we can see if people want to put their hand up or give us a wave. Has anyone got questions for our lovely hosts from today? Anything you want to ask about what you've heard or applying it in your own context? Andrew, go for it. Thank you.
I guess my question, just looking at that, is how I think the virtual world has made a lot of benefits and difference, but how do you kind of keep that energy and connection going if you're doing things in very kind of different ways, hybrid ways? And it sounds like there's an awful lot of work that went into some of the things that you've done, across different countries and I guess in different ways. But how do you what have you found that works to help that sense of connection to kind of get you to the kind of the end product, which I know is only the start product, but the end product of what you're doing?
Good question. Yeah, I think it's making space for connection in virtual sessions. We had challenges with this, but we were really determined to also prepare well for sessions, create a good invitation, follow up with people. And for example, when we had sessions on the Seeds of Change, we created a Seeds of Change document, synthesizing and sending that out to people to feed in or critique if they'd like to. And it is a challenge because people have kind of limited energy, but it's keeping things as transparent as possible, letting people know how they can sort of follow the work and stay connected, and keeping a mix of continued voices, people coming back to the sessions, but also bringing in new voices as you go, so it doesn't become too biased or create a sort of dominant core that's kind of dictating the future too much. But I'll just pause in case Suzanne or Susie want to speak to this, because I know you've also got lots of experience relating to that question.
I just wanted to talk about how much we worked to complement each other, with you, Eloise, being so amazing at facilitating workshop space. And then I was the person that was making sure that everybody was informed, comfortable, invited, that they had the feedback on time. I made sure once the project started to win awards that they knew they should put this project on their CV, because they helped co-create it, especially the young people that were involved. I kept in touch with everyone, including Futurice, about how the voluntary sector futures project was informing our strategy and our business plans each step of the way. So I would get back in touch and say, this is what we've done with it now, and this is what we found is really interesting. And you might want to speak to XYZ because they're very interested in your work. So I tried to add value to people's contributions as we went. And I also tried to keep, I mean, right now, we're here right now with you. The project happened 2 years ago. So there's still value in keeping this work sort of communicated. You know, we might work together in the future. So I think that's how to keep people involved, make it relevant, and make sure they're valued within it.
Thank you, Suzanne, and thank you, Andrew, for that question. I'm going to jump in because I'm conscious we're on 12:30, but I'm hoping that Eloise, Suzanne, and Suzanne might be able to stay on for a few minutes. So if you've got questions you haven't had the chance to ask, please do hang around. I'm going to drop a link to our feedback form for today in the chat, and as QI practitioners, I know that you will know the value of feedback and how important it is to get each of your individual reflections. We read every single one. It is really, really helpful. So please do it shouldn't take you more than 3 minutes. Please do take a few minutes to add your reflections from this morning's visit. And thank you so much to the Futurice team and to Suzanne. Thank you so much for giving up your time to come along and share all of your wisdom and your learning. And we will be sharing after today a resource pack where you can get access to the slides. You'll have their contact details. We'll share some more interesting resources for you to take forward. So we will hang on for a few minutes. I'll press stop on the recording. So if you've got more questions, feel free to ask. Otherwise, thank you so much and wishing you a lovely Tuesday.